Good afternoon. Today we're here with board member John Olivo. John has been on the board at Lebanon Family Health Services for 3 years. Good afternoon, John.
Good afternoon, Holly.
Hey, can you tell us a little bit what brought you to be on the board at Lebanon Family Health?
So I first got interested and involved with Lebanon Family Health in 2015 when I came back to the Lebanon area after living outside of it in Gettysburg for a little while. And immediately when I thought and saw Lebanon Family Health, I figured it was just a really well-run public health clinic or clinic. As I got to be involved with it more and more and got to know the people there, I realized there was so much more, and I wanted to become more and more involved with it. So I started out with being involved with a couple of committees, and then I expressed interest in taking that involvement even further to a next level. And so in March of 2017, Kim had asked me to if I wanted to be involved with the board. And ever since then, I've been on it and I enjoy it and love it. And I've learned more and more and more about Lebanon Family Health as I've been involved, and I'm constantly amazed on what that little building on Cumberland Street does.
So it sounds like you've learned a lot, that a lot of our services are about prevention. Can you speak a little
Yes.
bit about that?
Yeah, so when my vision or my thought of what a public health clinic looked like prior to this was completely overturned. When I found out that Lebanon Family Health had programs on smoking cessation, things for diabetes prevention, preventive health visits, walk-in visits, STD days, there was so many things out there that would help a person living in Lebanon do better with their health, even if they came from a situation where they were not well off or they did not have a lot of money or great insurance. They still could get very good preventive care. I think the one thing that impressed me the most was that really got me thinking was, because I don't have children, so I don't have the experiences of bearing a child or raising a child, was I had no idea about the WIC program. So I think the WIC program for me was probably the biggest thing that drew me in further to Lebanon Family Health, just because of the fact that there were so many things that could help the mother make the child bearing and raising experience better for that child.
Okay. Well, thank you, John, and thank you for your service to Lebanon Family Health. We want to continue to remind everybody that Lebanon Family Health Services is open and Mondays, Tuesdays, Wednesdays, and Fridays, and that we continue connecting with us for care. Thank you. Thanks, John.